Okay, well, what I'm working on, of course, is what I was working on was talking to people who use opioids, and I was working on what they thought about the different terminology that is used. Actually, this is a small grant that I got from Bentley, and I'm duplicating a study that they asked people what they thought of the terms used to identify or talk about people who use drugs. So terms like drug user is no longer being used, right? And terms like addict or junkie, definitely not. At least not by healthcare workers, not by people that work with people who use drugs. However, the people that use drugs themselves are still using these terms. Yeah, so they are, because they haven't been told socialized yet into this new terminology. So most of the studies that have been done in treatment, people that are in treatment, and they've already heard about the new terminology. And it's also, there's a thing called social desirability, where you want to say what's socially desirable. So their answers to this survey are usually social desirable answers. So I instead want to go and talk to people that are not in treatment, usually out in the street. I find them out in the streets, right? And they're not always homeless. They just hang out there, with other people, and ask them what they think. And the answers are very diverse. A lot of them still, of course, you don't want to be called addict. They don't want to be called addict or junkie, but they'll say that guy over there is a real junkie. It's really odd. But so that's what I was doing when COVID hit. And actually, right before the lockdown, I was on the street in Boston. What I usually do is I go out with somebody that I know that hangs out with people, that knows people that use drugs, and I call him a community consultant, him or her, and they just hang out with me to give me street cred. And so that way, it's not like I'm a busybody or a healthcare worker or something like that. I'm just a professor asking you questions, and this is my friend here. So I was doing that right before COVID hit, and I wasn't really worried about people on the streets, because a lot of these people don't travel much, and COVID was hitting a lot of the people that travel, right? So at the time, I wasn't too worried about that. But then after the lockdown, and now that COVID has come and hit most of America with not a very good response, I'm really excited about going back and finding out how this impacted them, especially people that don't have access to services. Somerville has great access to services. Boston does, but if you get further out into the suburban areas, you don't find as much access to services as you do in Boston. Well, I have a NIH grant waiting to be reviewed in October, and that was written to study women who are pregnant and have either used opioids recently in the past and got caught, or are trying to get off of it because they're pregnant. If you're pregnant, you're going to have a lot of surveillance on you if you're using opioids. And we found that out in our first study, that much of the surveillance that they had, they weren't able to really follow it. They would have so many places they had to go and do, and they didn't have much, they weren't given much resources for this. And so I wanted to follow these women throughout 2 years, and to see how, I call it surveillance, but it's, all these services they have to go to, and they're told what to do, because if you're pregnant with and you have any opioid use, you're usually put on methadone right away. And methadone is very hard to get off of. And so do they continue with methadone, or do they ever get any other kind of treatment, buprenorphine, that they could maybe come off of it? And do they get to keep their children or not? And that's the big thing. Right? They all want to keep their children, but they aren't allowed, because they get tested all the time. And if they have any other drug in them, their children are taken away, typically. That's what I found out for the people I've interviewed already. So we added a COVID component to that. So, already the women that I knew already that were under the care of a doctor or social services or DFACS, child services, it was very hard for them to follow all the regimen that they were supposed to follow. And often they would just get discouraged and think they're never going to get their kids back, and would use. And so I like to see what happened with COVID, how that impacted them. Did that make it worse for them? did it make it better in some ways? Were they provided more resources because of COVID? Um, and based on what we have seen, I think mostly it's going to be a worse situation for them. So hopefully this research gets funded. We go out there, involve these women for 2 years so that we have more information about what is needed and what we're doing now. Is it working or not? This has been very difficult, of course, for Americans that are disadvantaged, COVID-19. And I feel guilty almost because, I have a job, I can work from home, I don't have to go out, I can do everything on my computer, and I have good internet access. I don't have children at home, so I also feel lucky about that because I don't have to worry about the children going to childcare. But there's so many people that are not in my situation, and we don't really we're not really understanding their situation. So I like to go out there and find out what happened, especially to the disadvantaged people. I mean, not only the homeless, but the housing insecure, right? The ones that are in rentals now, and there was a moratorium on rent. Now that it's over, what happened, and do they have to pay that rent back eventually? The employment insecure, right? Those that have service work, but they get sick and they don't get paid, right? And, and the stress that they have with the children at home. And even if they can bring their work home, what can they do with their children? So these are all things that I'd like to find out more about, particularly among the disadvantaged people and people that don't have the same resources that we always hear about, that we're used to.